Hello, I'm Dr. Vyas, founder of New Wave Wellness Center, and in this video I'm going to be talking about autoimmune diseases. Now, we're all familiar with autoimmune diseases because there's a ton of them now. We see a lot more people ending up with autoimmune disorders than we had ever seen before. So this video is going to explain exactly what an autoimmune disease is and what are the main factors which influence why autoimmune diseases occur. So again, just talking about autoimmune diseases, we're familiar with things like your lupus, your MS, multiple sclerosis, rheumatoid arthritis, Hashimoto's, your thyroid problems, Crohn's disease, the list goes on. As I said, there's 190 different diseases that are classified to be as an autoimmune disorder. So what exactly is happening with an autoimmune disease? This is where your immune system kind of goes haywire. Your immune system starts attacking its own self, or it's attacking different parts or different organs of your own body instead of attacking a foreign substance. So the immune system is designed to attack anything foreign, anything that it sees in the body that is not supposed to be there. It'll create what we call an immune reaction and help fight that away. But when we have certain factors which kind of twist the immune system in a specific way, which make it go haywire, and so what it starts doing is it starts attacking its own self. So we have things where, so like again, when we take rheumatoid arthritis is not a joint disease. It's not where your joints are, diseased. It's your immune system that's attacking your joints, and that's why you're ending up with rheumatoid arthritis. Same thing goes with Hashimoto's. This is where your thyroid didn't just stop working. This is where your immune system again is attacking your thyroid and is creating this whole Hashimoto's or an immune disorder. So let's talk about what exactly causes, or what exactly are the main factors which influence how and why a lot of people are ending up with all these autoimmune diseases. So what I've drawn is just a little bit of a simplification. It just kind of simplified this thing just to give you an idea of exactly why it's happening. So let's start with the number one issue, and that is your blood sugar levels. We're all familiar with, blood sugars. This is where we get all these big highs and lows, the spikes, which is not a good thing. High sugar levels and low sugar levels. These things cause your immune system to start going again. This is one of the big reasons why the immune system kind of gets a little messed up and starts causing problems. Instead of having this very normal curve of, a gentle rise and dive of your sugar levels, when you get these big spikes and big lows, it starts causing your immune system to start creating more damage to organs that you have, being attacked by your immune system. Now, the second thing that also starts affecting a lot of this deal is what we call the adrenals. Now, I've talked about the adrenals a lot in a lot of my different videos. Your adrenals are your body's stress handling organs. These are the ones which kind of, produce cortisol, produce adrenaline. These are things that help your body deal with stress naturally. Now think about it. This blood sugar level is another big thing, which is when you have a big spike or a low of any of these blood sugars, that's also considered a stress to the body. So what does that do? It causes the adrenals to pump out more of these hormones and create issues. Now, the adrenals are also part of our fight or flight response. So what we also check to make sure is we do check the adrenals for your cortisol levels, but we also check the neurotransmitters in the brain, the chemicals in the brain which are constantly triggering you to be in that fight or flight response, right? So it could be where, you could be sitting at a beach in Miami or in Hawaii and your brain is still firing constantly. So it's something that can be, different factors that influence the adrenals to constantly produce those big surges of hormones. Now, the other big thing is estrogenic events, estrogen in the body. That's one of the big reasons why women are more prone to having autoimmune conditions, because when you have a big surge of estrogen in the body, it can cause the body to kind of signal things differently. So usually what I've seen in my office, I have a lot of women that come that have been diagnosed with, say, Hashimoto's, a thyroid problem. After their first, second, third child, that's again after childbirth, they get a big surge of hormones there, and that can lead to that. Now, recently I also had a few young teenage girls that are going through, ending up with Hashimoto's. What's that caused by is puberty. When you end up with a lot of this big surge of hormones then, or even taking a lot of the birth control pills, which are estrogenic, or, that can twist the body into a whole different thing and end up with an autoimmune issue. Another big thing is leaky gut. We've again mentioned a few of these things a lot of times because we know that 70% to 80% of your immune system lies in our gut, right? In the small intestine and in the linings of that. So leaky gut is where your body you're taking things like high doses of antibiotics, NSAIDs, just bad diet, those kind of deals will destroy the gut lining. And when you destroy some of that gut lining, it creates this whole leaky gut issues, which means it's heightening your immune system. And that will lead again to your autoimmune issues. So again, with leaky gut, it's a whole different story. I've mentioned that in a few of my videos. It's not just taking probiotics to kind of help cure. We need to know exactly what is going on and fix that or correct it the right way for this thing to help heal the gut. Now, the other big thing is infections. We know, as I just mentioned, that when your body has an infection, you produce an immune response. This is where your immune system will help fight off an infection. But recently, research has shown that there are certain infections on the rise, like your Epstein-Barr virus or your mono. Mono is a disease or an infection which, even though you take antibiotics, the symptoms may go away, but it kind of lodges onto certain cells. And when it's there, hidden in between cells, your immune system is doing what? It's constantly firing because it's trying to look for those guys. And while doing that, it starts attacking itself, again, causing this whole autoimmune issue. So again, we need to look for the root cause or find the infection, clear that out completely for the immune system to kind of calm itself down. Now, the third one here, this one you might think is very important or interesting, is your vitamin D levels. See, vitamin D is an immune modulator, which means it actually turns on and off your immune system. So if you're very low on vitamin D and your immune system is not turning on, or even when you're low, it can still trigger a lot of things in your immune reaction. So what we always do is we check for your vitamin D levels. You know, the vitamin D levels are ranging anywhere from 30 to 100. So when you're about at 30 or 40, the doctor says, hey, you're okay, you're in range, so you should be fine. But anybody with an autoimmune issue, we like them to be closer to 60 to 80 on your vitamin D levels. When you're higher, you have more vitamin D, and you end up with, you know, less of any of these autoimmune issues. And especially living in the northern hemisphere, we barely see the sun a lot, and or even though we see the sun, we're always either covered up with some, sun blocks, or we're wearing sunglasses that are UV protectant. So all that UV, we need that ultraviolet light to help the body make vitamin D. And since we're not making that, we always suggest you take some form of vitamin D. So this, I know it's a bit of a quick rundown of this, but I hope this kind of gives you a little bit of an idea of exactly what is the main cause of the culprit in autoimmune issues. Now, when it comes to the protocols for it, there's no single protocol. I'm not going to just, when a patient comes in and says I have an autoimmune issue, it's not just, oh, here's a bunch of supplements, take these and let's see what happens. That's not how it works. It is very individualized. Because again, there's different factors that affect different people. Somebody might have this kind of problem and not this. So, and then maybe they have this and not blood sugar issues. And so we need to find out exactly where the problem is or what is causing this immune system to go haywire and help correct it from there. So it's totally individual based. We test for a lot of all these things in the office. We look and see exactly where the levels of these things are, and we see where your body needs that correction. So I hope this information helps, and if you know anybody that's suffering with any kind of autoimmune problems, hope you share this video with them, let them know exactly what is going on and what can be done for it. So I hope you like this, and hope you share this video with as many people as you can, and I'll see you in the next video. Thanks.